Cosmetic surgeons versus plastic surgeons. A board-certified cosmetic surgeon is not a plastic surgeon. You may not have realized that because there would be no way for the average person to know the difference. Plastic and Reconstructive Surgery is the official journal of the American Society of Plastic Surgeons. A study published in our journal found that nearly 10% of the members of the American Society of Cosmetic Surgeons aren't even trained in any surgical field. That's right, they weren't even trained as surgeons. Over 60% of members of the American Board of Cosmetic Surgery advertised surgical operations that were beyond their scope of practice. That means those operations were those for which they were not adequately trained. Those medical backgrounds included internal medicine, general surgery, gynecology, dermatology, and oral surgery. The operations advertised by those non-plastic surgeons were breast augmentation, abdominal liposuction, rhinoplasty, facelift, buttock augmentation, and many more. Basically, the operations they were advertising were some of those that get the quickest buck. Patients assume that when they hear the words cosmetic and board certified together that it must make that doctor a plastic surgeon. That couldn't be further from the truth. Many cosmetic surgeons take offense at the suggestion that they can't do major aesthetic surgery operations just as well as a plastic surgeon. The fact is they just can't. They don't have the same technical training to do those operations, and they certainly haven't been extensively trained in how to do those operations safely. One 2-day Board of Cosmetic Surgery course advertised a 1-hour session on patient safety. The training and certification process that cosmetic surgeons go through doesn't remotely compare to what a plastic surgeon does. Because there's such a high demand for aesthetic plastic surgery procedures and there's no easy way to educate the public, people go to those doctors and assume they'll get the same quality results and attention to patient safety as with a true board-certified plastic surgeon. The fact that you're watching this video may mean that you're researching doctors and procedures to help you achieve a certain look, one that requires surgery. Think about what you're considering having done. If you're going to put your trust in someone, you deserve to have the information you need to make an educated decision. With doctors in the Cosmetic Surgery Board, you won't have access to the information I just gave you. They depend on your lack of information to convince you to have major aesthetic surgery done by them. Just think about letting a family practice doctor open up your abdomen, or a gynecologist do a facelift on you, or a pediatrician do liposuction on your body. If you knew what the qualifications of a cosmetic surgery doctor are, you most likely would look elsewhere. Educate yourself and look on the doctor's website for the symbol of the American Society of Plastic Surgeons, as well as the words board-certified plastic surgeon or certified by the American Board of Plastic Surgery. Most will also be members of the American Society of Plastic Surgeons, not cosmetic surgeons. There's another video on my channel about the type of training so-called cosmetic surgeons get before they do major surgery on unsuspecting patients. It's a real eye-opener, and I hope you take a moment to check it out.